67-year-old African-American woman visits clinic with complaint of fatigue that started gradually and slowly became worse over the past 4 months. She became short of breath after walking a few blocks and has difficulty climbing stairs. She denies chest pain or leg swelling or cough. Her past medical history is significant for osteoporosis and GERD. She takes omeprazole as needed in addition to a daily baby aspirin. She is a retired accountant and lifetime non-smoker, but she drinks a small glass of red wine every night before bed. Her diet is varied. Today, her blood pressure, heart rate, respiratory rate, temperature, oxygen saturation are all kind of normal. She has marked conjunctival pallor. Cardiac auscultation reveals a rapid heartbeat with regular rhythm and systolic murmur over right upper sternal border. Lungs are clear to auscultation bilaterally and abdominal examination was within normal limits. A peripheral blood smear shows microcytic hypochromic RBCs. The following are the lab values. Hematocrit is low, hemoglobin is low, RBC volume is low, platelet is kind of normal. Which of the following will most likely be present in this patient? Increased reticulocyte count, decreased reticulocyte count, decreased erythropoietin level, increased WBC level, or thrombocytopenia. So this is a woman who complains of tiredness. She has murmur over right upper sternal border, and her peripheral blood smear findings are given. Which of the following will additionally be present? So there is this patient who has a lot of tiredness and all that, and there is pallor, tiredness, increased heart rate, um, systolic murmur, microcytic hypochromic anemia, and this is the CBC finding. So what is the diagnosis here? Yes, so this is iron deficiency anemia, microcytic hypochromic anemia, this is iron deficiency anemia. Since this woman is postmenopausal, we can think of the number one cause is bowel cancer, large. So if there is an old age person who comes to you with iron deficiency anemia, postmenopausal woman, or a male who comes with iron deficiency anemia, we do a colonoscopy. This is an extra point if you want to remember colonoscopy. In a premenopausal woman, the first thing that should come in your mind for iron deficiency anemia is heavy menstrual bleed. That is the number one cause. In postmenopausal women or males, the number one cause, or elderly males, the number one cause is colon cancer, and we do a colonoscopy to detect whether this person is having colon cancer. Anyways, that is not the question here. The question is which of the following would be present in this patient. Now we have diagnosed that this patient has iron deficiency anemia. What we have to look into is what else we will find in iron deficiency anemia. Okay, so I will first remove certain points which do not make sense. We do not have anything to do with WBC and platelets, so I'll just cut it out. We won't find decreased erythropoietin. Erythropoietin will be increased because we have decreased RBC counts, and body would want to make more RBC, so erythropoietin will be increased. So this is wrong. So we have to now choose between increased reticulocyte and decreased reticulocyte. So now we have to remember that reticulocyte count increases whenever there is a hemolysis or there is external bleed. So basically, increase in reticulocyte count means that body is body has less number of RBCs, and body is giving away any form of RBC it is having to compensate the less number of RBC. So it is even giving away, it is putting in the body, it is putting in the blood, even the immature reticulocyte, because the RBC count is low. So that means that is what increased reticulocyte count is. So this can occur only when body has capacity to make even immature RBC. So body has capacity to make immature RBCs when there is enough store of iron. Even immature RBCs are going to need iron, like basically heme formation, hemoglobin formation inside them, for which there is necessity of iron. So in hemolysis or in external bleeding, there is no deficiency of iron. There is just either internal hemolysis or there is external loss of blood. Due to any cause, there is decrease in RBC count and body starts making immature RBC. In iron deficiency anemia, body would ideally like to make immature RBCs, but what is going on? There is not enough iron to make that. So that is why, although the ideal condition would be that the body should be having more reticulocyte count, the body does not have capacity to do that. So there is decreased reticulocyte count. So this is a very important differentiating point between how to differentiate between anemia due to let's say hemolysis or external bleeding, and anemia due to iron deficiency anemia. So in iron deficiency anemia, you would always have decreased reticulocyte count, decreased retic, and in external bleed or hemolysis, there will be increased reticulocyte count. This is an important differentiating point. We always tend to forget this point because we keep on remembering which one is hypochromic, which one is microcytic, which one is which. So reticulocyte count is something that gets actually ignored, but this is also an important differentiating point between anemia due to hemolysis or external bleeding and anemia due to iron deficiency. Reticulocyte counts will be decreased in other conditions as well, like let's say in microcytic anemia as well, in anemia due to B12 or folate deficiency, because they do not have, the body does not have enough nutrients to make RBC. The nutrients can be, let's say, iron, or the nutrient can be B12, or the nutrient can be folate. So any kind of deficiency anemia, a better way to put it is, any kind of deficiency anemia will have decreased reticulocyte count. Any type of hemolytic or external bleed, basically loss of blood, kind of anemia is going to have increased reticulocyte count.
Thanks for watching. Please give a thumbs up and subscribe for more.